Adults diagnosed with attention deficit hyperactivity disorder, or ADHD, often navigate challenges that go beyond inattention and impulsivity. Doctors have long noticed that adults with ADHD frequently experience other mental health challenges, including personality disorders. Personality disorders involve deeply ingrained, inflexible patterns of thinking and behaving that differ from cultural expectations and cause distress. Past research on how often these two conditions overlap produced widely differing numbers, ranging from 10 to over 70%. This wide range partly stemmed from researchers using different frameworks to measure personality traits. Some used sliding scales, while clinical guidelines require a categorical approach where a patient either meets the exact criteria for a formal diagnosis or they do not. To get a clearer picture of actual diagnoses, researchers conducted a meta-analysis. They combined data from 11 studies that included over 2,100 participants. These studies mostly took place in specialized outpatient clinics or general adult psychiatric services. The researchers tracked how many individuals met the formal criteria for various personality disorders and documented the assessment tools used. The synthesis of this data revealed a very high rate of co-occurring conditions. Based on a subset of the studies, the researchers estimated that 57% of adults seeking clinical help for ADHD met the criteria for at least one personality disorder. The most frequent co-occurring issues involved passive-aggressive patterns at 25.3%, avoidant patterns at 23.1%, and borderline patterns at 21.9%. Other conditions like antisocial and dependent personality disorders were also common. These numbers represent a 5 to 10-fold increase in personality pathology compared to the general population. For example, avoidant patterns affect roughly 1.5 to 2.5% of the general public, but they appeared in over 23% of the adults with ADHD in these clinical samples. The researchers noted extreme variation between the individual studies. They found that the choice of diagnostic tool was closely linked to the results. Studies using self-report questionnaires, where patients answer questions about their own behavior, consistently yielded higher rates of personality disorders than studies using structured clinical interviews conducted by trained professionals. The testing environment was also associated with the final numbers, with patients in specialized clinics being more likely to receive a personality disorder diagnosis. Learn more about this study and other new research at PsyPost.org.